Okay, so I'm here with Haja Wurie from the College of Medicine and Allied Health Sciences in Sierra Leone, and she's going to share with us her views of the impact Ebola's had on the health system and how she thinks that's impacted vertical programs such as the NTD control program. So firstly, Haja, could you just share with us a little bit about yourself and your work in Sierra Leone?
Okay, thank you. Good morning. I am a health systems researcher attached to the Rebuild project. And the Rebuild project, it's all about doing health systems research in post-conflict countries. And we're working in Sierra Leone, Zimbabwe, Cambodia, Uganda, and in partnership with the Liverpool School of Tropical Medicine and Queen Margaret University. And it's all about generating evidence to inform policy making and strengthening the health sector in general. In Sierra Leone, it's hosted by the College of Medicine and Allied Health Sciences, so I work for the College of Medicine in Sierra Leone.
And can you tell us, in your opinion, what impact has Ebola had on the health system in Sierra Leone?
I think Ebola has exposed all the weaknesses in the health sector in the health systems in Sierra Leone and the other affected countries, and it goes across all the 6 different pillars of the health system. If you look at the health, the human resource for health pillar, you look at service delivery, all the other different pillars, it's just exposed the weaknesses, and it shows that more needs to be done to strengthen the health sector to ensure that we're moving towards providing universal health coverage for all.
Okay. And specifically, how do you think this has influenced vertical programs such as the NTD control program?
In Sierra Leone, when Ebola started, one of the most major concerns was the decrease in service utilization, wherein service users were afraid to go to the health facilities for a number of reasons. So it fueled this level of mistrust between service users and service providers, so people were staying away. And what that meant, people were dying at home from conditions that could have been easily dealt with. So if I was to put that in relation to the NTD program, Ebola impacted everything. It's not just those who ended up contracting the virus, it's the fear that it came with that prevented people from going to the health facilities. And NTD in Sierra Leone, it's something, the focus mostly is on HIV, malaria, so on and so forth, and efforts have been made to strengthen the NTD program. So if you think about the impact of Ebola in preventing people from going to the health facilities, it's, in a way, it's like taking a step forward and taking 3 steps back. So it's caused a massive negative impact, I think, on these vertical programs.
Okay. And how has it impacted the health workforce, particularly frontline providers, including the community health workers?
I think health workers have been victims throughout. In Sierra Leone, for instance, Sierra Leone is a post-conflict country, and Ebola, as far as I'm concerned, is a crisis. So in both situations, health workers have been victims. And during the conflict, they were easily targeted. They were kidnapped for a number of reasons to provide health services behind enemy lines. And during Ebola, they're at the front line. And in the beginning, they were not adequately supported in terms of having the right protective gear for them to work safely. The number of issues with the level of training that they received. Ebola was very, very new to Sierra Leone. They didn't know how to handle it. And it's kind of like a historical problem, because continuous training, on-the-job training has always been an issue in Sierra Leone. And that's one thing that Ebola has exposed, that should be in place. Things like IPC, infection prevention control. It was talked about, but it was not being implemented. It was not being practiced, because if you look downstream, the enablers are not there. Most of these health facilities, particularly in the remote parts of Sierra Leone, there's no running water. There's no soap, the equipment is not there. So how do you expect them to practice IPC if it's not there in the first place? So I think they were exposed, and it's because of a number of underlying factors that were ignored, that have been ignored for so long. And I think we've got to the point now where they cannot be ignored anymore.
Okay, thank you. And what do you think are the key steps or priorities in rebuilding the health system as Ebola is controlled and post-Ebola?
Health systems research should be a priority in the affected countries. In Sierra Leone, for instance, we do have health systems research, but it's purely led from outside. There needs to be a degree of national ownership in health systems research. Evidence should be generated to inform policy. It's like you cannot develop a policy for someone if you don't incorporate their voices. Then it's not going to be effective. Then it's just a bunch of people sitting in a room and deciding what they think, but not actually understanding what the challenges are on the ground so they can address them effectively. So I think health systems research should be a priority in these countries. There should be a lot more investment in health to ensure that health systems research is sustainable and led nationally. Yeah, and I think there needs to be coordination as well of efforts, because a lot of people are coming in, a lot of support is being provided, but it needs to be coordinated to avoid duplication of efforts and to ensure that there's continuity. And yeah.
Okay. And how do you think we can rebuild trust between the communities and their health system?
Health education and health promotion, and I think that's where community health workers come into play, because during the outbreak in Sierra Leone there was travel restrictions where people were not allowed to move within the district, and that affected a number of health services that were being provided by a number of development partners, because they could not go into these communities. So what most of them ended up doing was recruiting people from within the community to ensure that the services were not further disrupted, and that proved to work effectively, because they see these people, community health workers within their communities, as one of their own. It's not somebody coming from outside who you don't know where that person has been, you don't know what that person is bringing into the community. So I think community health workers are quite important in that regard, because if they can take out these messages into the communities where they're, and most of them are quite respected within their communities anyway. So if they can take those health education, health promotion messages and get the religious leaders, the tribal chiefs, because they're what they say, basically people tend to stick to that. So try to get them involved. It should be a concerted effort. But there needs to be enough sensitization, enough health promotion to try and dilute down all the other beliefs that people would rather believe. So it's trying to counteract that to ensure that we're sending out the right message about health promotion, health education.
And how willing do you think that the community health workers will be to continue their work post-Ebola?
I think they'll be very, very willing, because they take these jobs quite seriously. It's a sense of, it's like giving back to their communities, and it's something they do with pride, and a lot of them, respect is attached to that within their communities, and they're quite willing. Going out into the communities in Sierra Leone, particularly in these remote parts, I've come across some community health workers, and if you think about the incentives that they're given in terms of financial incentives, I think it was 15,000 leones every 3 months. That's the equivalent of $3. So financial incentive is not what is driving them. So if they're supported, they're given the right training, they're given the right resources to go out into these communities, then it's going to be a bonus. But there could be a downside to it, wherein some of them might want to do things that they're not supposed to do, because there's always the danger that if the more training you give them, they think their roles have changed, and they might want to become what we call quacks within these communities. So it's ensuring that there's adequate management of them to ensure that they're doing what they're supposed to do, and people are not seeing them as doctors within these communities. But I think the work they're doing, especially within the Ebola crisis, has been great. They have ensured that a number of services continued even though the outbreak was ongoing.
And how do you think that the communities themselves will respond to the reintroduction of community health programs through community health workers, such as mass drug administration or vaccination programs?
I think it will be welcomed because, as I've already mentioned before, it's one of their own. It's usually it's a son of the soil, so it's one of their own, and they'll be quite willing to receive, because that community health worker within that community can relate to members within that community a lot more. So it's provided that they have the right information, they're doing what they're supposed to do in the right manner, I think it will benefit everyone in the long run.
And what role do you think vertical programs such as the NTD control program can play in supporting health system strengthening post-Ebola?
I think that will come under the essential service pillar of the health sector. So for me, for the health system to be responsive and resilient in the face of any other outbreak, all the 6 pillars of the health system should be strengthened. And essential service is one of them. An NTD program, the vertical programs, they follow under that. So it's ensuring that everything that is being done within the 6 different pillars is done at the right pace without one lagging behind the other. It's ensuring that there's enough coordination, ensuring that strengthening one pillar creates the platform for strengthening the next pillar. It's just ensuring that everything is done in a coordinated manner, because lessons should be learned. This is post-Ebola. I can describe it also as post-crisis. Post-conflict. We've had a post-conflict period in Sierra Leone, and things were done, but they were not done effectively because the health system is still struggling. So lessons should be learned from that, and coordination, and ensuring that every pillar of the health sector, nothing should not be ignored, because the second you start ignoring these issues, they become bigger issues. So it's learning from that and ensuring that things are implemented effectively in the post-Ebola reconstruction phase.
And to what extent do you think that the health system strengthening post-Ebola or post-crisis offers opportunities for a more integrated, equitable response to communicable and non-communicable disease surveillance and control?
I think it all goes back to lessons learned. We cannot afford to have another outbreak and it's managed in the same manner as this one was, because everywhere Ebola has struck, it has a tendency to come back. So it's ensuring that everybody's on the same page, everybody's working towards a common goal, to ensure that the health system is resilient. It should be responsive. Health workers should be supported. Training should be done before, in preparation, not during the outbreak, which is what happened during the Ebola outbreak. Fair enough, it was the first time it hit Sierra Leone, so you could say yes, but second time round, that should not be the case. The enablers should be in place, and every other program supporting the health sector strengthening should be on the same page. There should because it's to try to avoid fragmentation. Because if you come in and do your bit of thing, and then you leave, if there's nobody else to continue with that, then you've not gained anything much. It's fragmented, and trying to connect those dots, it's time and effort being spent that could have been used elsewhere. So it's ensuring that in the post-Ebola phase there should be coordination of efforts. It comes down to coordination within the ministry. The Ministry of Health should take national ownership. They should take ownership in these decisions, and the development partners, researchers, whoever else wants to support the health sector should be supporting the ministry working towards a common goal. That's what I think.
And how can donors best support those activities and health system strengthening then post-Ebola?
It's all about, there should be a plan, an action plan, and donors should identify where their strengths lie in that action plan and contribute towards achieving that target. And there should be internal monitoring systems and external, because in Sierra Leone we've had an issue with implementing things. Policies will be developed on paper, all well and good, but then when you look at how well have they been implemented, not so well. And it's something that has been going on. It's a historical problem, so it should be addressed. But I think having an action plan where clearly defined roles and responsibilities are given to donors or whoever wants to support the ministry, then somebody could be held accountable, so to speak. But then they should have these internal and external monitoring systems to monitor the progress of these points.
And what role do you think that multisectoral partnerships can play in supporting the health system strengthening?
I think they play a very important role because they bring different skill sets to the table. And so there's the possibility of capacity building, which is very much needed in these settings. It's how do I put it? It's bringing skills that are not necessarily there and building capacity, so to speak. And capacity being built should be sustainable, because so when they leave, it continues. Whatever work they've started, the platform, the foundation continues. Somebody is there to continue with what they've started. And it goes beyond the health sector as well, because if they bring different skill sets, it goes beyond the health sector, and it works towards a greater good, because then it contributes to the bigger picture of supporting the system as a whole, not looking at health in isolation, but it's having these, because there's these connections between the different sectors, health, education, so on and so forth. So it's ensuring that in addition to building the health sector, there's also talk between these different ministry and development agencies.
And what opportunities do you see there for sort of south-south learnings between the Ebola, different countries that have been affected by Ebola?
I think that is something that should not be overlooked. There should be talk. Sierra Leone, Guinea, and Liberia should be in constant dialogue as to what they're doing to rebuild their health sector. And I think an opportunity was missed in Sierra Leone, for instance, in the beginning. If I in Uganda, for instance, Ebola has struck many times, and they know how to handle it. Lessons should have been learned from that, and but I think that opportunity was missed. So I think the possibility of networking should not be overlooked, and it's something that should be a priority. And Sierra Leone, Guinea, Liberia, to a large extent, they've gone through similar issues in the past. So lessons should be learned in that regard. There should be talk between these three countries with regards to what the recovery plan priorities are, what are their action plans, how will they be implemented, and knowledge sharing. That platform should be there. That door should not be shut. There should be that platform of knowledge sharing between these three countries.
And my final question for you is, you touched on the importance of health systems research earlier. So I just wondered what you thought the key issues for health research would be post-Ebola.
My main concern is that post-Ebola, research will be focusing on, it will be very one-sided in that people will tend to look at the like IPC training, the issues that are directly related to Ebola, and they might overlook other issues that are equally just as important. Because even though Ebola was there, it was killing people, but then other things were there as well. They were causing more damage, equally more damage. So it's ensuring that health systems is across the board. There should be coordination between the researchers, the academics, and the policymakers, the decision makers, to identify what the priorities are, and accordingly funding should be allocated. So that goes back to investing more in health, meeting the Abuja Declaration, investing more in health and supporting local health systems research so that the challenges could be understood in the local context, and support the decision making. Evidence should be there, and yeah.
And is there anything else that you would like to add?
Just to reinforce the point that health systems research should not be overlooked. There should be an emphasis on it. It's always been the case of we tend to respond to challenges that have been exposed by a particular incident, but try to look at the bigger picture and trying to coordinate everything that's being done. Things should be done in a systematic manner. Activity A should create the platform for achieving activity B. So somebody has to look at it with a critical lens, look into the future and see how do these activities come together, and ensure that it's implemented effectively along the way. I think lessons should be learned this time round. There's no more room for excuses. It's ensuring that things that on paper that we have identified that these are problems, they should be implemented effectively. And if the skills are not on the ground, then they should look at bringing the skills on board and ensuring that those skills are passed on and ensuring that they're sustainable.
Okay, thank you very much for your time.
Thank you.